All right. Good evening, everybody. I'm Dr. Frank Cadle, and this is my weekly multi-platform live that persists in the face of all technological difficulty. And I really want to thank everybody for joining. Thank you so much for sticking with me. If you guys have any questions, you can ask them on the live. Welcome, La Croissant, I don't know. Good evening. Thank you, Shubi. Good to have you here on the live. Really appreciate everybody coming, and I hope everybody is ready with questions about colorectal cancer. This week is Colorectal Cancer Awareness Week. Wow. Really struggling with the coordination of all these different. That probably kicked me out of that one. Oh, no, it did not. At least I don't think it did. Yeah, trying to do Twitter Spaces, I think, may be a waste of time because there doesn't seem to be a lot of traffic on there for me. But on Get Fit and Be Lean, master your domain. Excellent. I'm Dr. Frank Cadle with the Get Fit and Be Lean program that I used to lose over 20% of my body weight in 2021. I lost more than 5 inches off my waist. I lowered my cholesterol by more than 20 points and my systolic blood pressure by more than 20 millimeters of mercury. I did all of this without any medications. I didn't buy any equipment or enroll in any programs. And I want to try and carry the message out to you if you are struggling and maybe failed on your New Year's resolution. Thoughts on the Cologuard, an excellent option for colon cancer screening for people who may not have the availability of endoscopic screening with a colonoscopy. However, I don't believe the Cologuard replaces colonoscopy, and I do think that even if it's positive, you're going to have a colonoscopy anyway, and you cannot remove adenomatous polyps with a Cologuard. So, Mehran, you didn't let me down. All right. So the reason that I'm focused so much on colorectal cancer is it is Colorectal Cancer Awareness Month. And a lot of people aren't aware that this is the #1 cancer killer in the country. We're talking tens of thousands of new diagnoses every year. We're talking many people who have to go through surgery, have to go through chemotherapy if it's an advanced stage. And the fact is, this is one of those cancers where if we catch it early, we can cure it. It can surgically be removed and it's gone and you don't have it. Oh, welcome, Samo, on Instagram. Thank you for joining. Really good to have folks on all the different platforms. Makes a big difference. So, since it's true that if you catch it in the early stage, this is one of those cancers that we do recommend aggressively screening for. We've lowered the recommendation to 45 years. You can see that younger people are developing colorectal cancer and presenting later stage because they haven't gone through any screening, because the screening isn't recommended unless you have a family member who has colon cancer. And then you should have your screening starting 10 years younger than when they developed the cancer. Am I currently licensed? Yes, I am a currently licensed physician, and I'm glad you won a contest, Paul. Polyps do generally indicate that you need a more intensive screening, and so you should probably undergo colonoscopy every 3 years, or depending on how many and what the pathologic finding is of them, even every year. But tonight, what we're talking about is how to decrease your risk. Now, everybody has a familial risk related to what their family history is, what their genetics are. And with these risks, I don't really talk about them much with my patients because you can't change your family. You're stuck with what you got. So what you can change is your fiber intake. And there are three main modifiable colorectal cancer risk factors that I am going to discuss as a part of the Get Fit and Be Lean program. Number one is fiber. Number two is red meat. We'll be talking about that all next week. And then number three, in decreasing your risk, is avoiding a sedentary lifestyle. And this stuff plays right into my own program, the Get Fit and Be Lean program, and the fact that you can change your risk based on your behavior. So there are some things that there's nothing you're going to be able to do. You're either going to get it or not. But this is something, chronic stress, anxiety doesn't cause cancer. I'm not sure where that started circulating, but that's just not the case. Correlation never infers causation. However, risk factors are risk factors, and they are strongly and scientifically validated in the area of colon cancer because we have so many patients that we can study. So lack of dietary fiber is a significant risk factor for the development of colorectal cancer. And if you want to take a look at my Twitter feed, you can see my tweets all this week have dealt with that risk. And this is something you're never going to hear the carnivores talking about colorectal cancer risk because the information is just indisputable. It is ironclad. So, a cause and effect. No, it's a risk and a result. If you don't wear your seatbelt and you never get in a car crash, you don't realize the risk that you put yourself under because it's a multifactorial event. Okay. You got to have the airbag doesn't go off. You're not wearing your seatbelt. Okay. So if you want to modify your risk factors, one way you can do it is with the 2 veggie goal, and that is 2 servings of raw or steamed vegetables with lunch and 2 servings with dinner. And there are so many different benefits of this, and that's why I've made it kind of the bedrock of the Get Fit and Be Lean program. Typically, I talk about it as associated with fitness and weight loss, but it also ties in with colorectal cancer risk. And a lot of young people are realizing their increased predominance of young people being diagnosed with colon cancer. People under the age of 45 have gone from, hardly ever being seen as colon cancer patients to suddenly now it's 10 or 20% of the presenting patients are younger than we would typically screen for the disease. So I would highly recommend everybody, if you have a family risk of this in your background, if you have a concern because you have some of the other risk factors, you can modify your own risk with the intake of leafy green vegetables. And when I talk about vegetables, I'm talking about leafy greens. I'm talking about kale, kohlrabi, fennel, spinach, celery. I'm talking about those things that grow above the ground, contain chlorophyll, so you don't need to buy any chlorophyll drops. Welcome, white cheddar. I'm talking about Colorectal Cancer Awareness Month and how that ties in with the Get Fit and Be Lean goal of 2 veggies, okay? 2 servings with dinner, 2 servings with lunch, raw or steamed. And it's really not that hard to accomplish, okay? One of the reasons I like to grow sprouts is you can throw some sprouts on top of just about anything and add a serving. The consumption of fiber since the 80s has multiplied times 6. Yeah, I'm going to have to mute you on that one because that's just false. That's definitely a lie, and I'm not going to let you distribute lies on my live. But I am going to talk later on this week about meat and meat intake and how meat increases your risk of developing colorectal cancer, regardless of what the carnivore guys might want to say. Yeah, I mean, trying to affect other people's diet is nigh on impossible, even if they're kids and they have to eat what you give them. What I would recommend is that you experiment with different types. And I myself, when I started this program, 2 servings is quite a bit, and 2 servings at lunch, 2 servings with dinner. This required me to expand my own repertoire to include things like arugula, which I'd never really eaten before, but now I eat on a pretty regular basis. And so asparagus, Brussels sprouts, I grow regular bean sprouts. I grow them right in the kitchen, and you can throw those on a sandwich. You can throw them in a salad. I do recommend, spinach is great. You can just steam it on its own. You can throw it in a salad. You can throw it in a bowl of ramen and add some roughage that way. So the 2 veggie goal, 2 servings with lunch and 2 servings with dinner, can have a direct impact on your colorectal cancer risk. And that's what we're talking about all week, all month. We're going to be talking about Colorectal Cancer Awareness Month, which is March. And I'm going to talk about diet. Last week, I talked about fiber. I posted some really good articles on my Twitter feed. This week, I'm going to talk about red meat. I like red meat. I eat red meat. I'm not going to stop eating red meat, but the relationship is clear. And so the question is, how can you go about still enjoying what you want to eat and yet maybe reduce your risk and maybe even lose a little weight? And one way you can do that is with Meatless Monday. So I hope you guys will join me. I'll be doing Meatless Monday tomorrow in honor of Mr. Paul McCartney and many other people who recommend decreasing our intake of meat for both cardiovascular risk, colorectal cancer risk, as well as environmental impact. So thank you very much for the follows and the likes. I really appreciate everybody that joined tonight. Man, we got like 25 people still in the room there on TikTok. That's great. And hopefully some folks will see this on YouTube and as well as Instagram. I do see you out there, Samo and Lacrosse, and I appreciate you joining the live. And I hope to make all of these available pretty much at any time that you want to get on my YouTube channel and scroll through there. But you can see the whole program on TikTok. You can scroll back on my profile to January 1st. You can see me struggling to do even 5 sit-ups, half a dozen push-ups, and a dozen jumping jacks. And you can see the change that occurred in me as I changed my diet and how I went around achieving some satiety to where I didn't feel hungry all the time. I didn't sacrifice the foods that I like to eat, but I still achieved my goal. So if anybody has any questions, this would definitely be the time to ask. If not, you can always go and take a look at my videos, make a comment or a question later. I might even make a whole video just to answer it. But if not, I think I'll go ahead and finish up for tonight. And you can watch this pretty much anytime on YouTube. Thank you very much for joining. And that ended up going a lot better than I expected, which is always nice.